pineapple under the sea.
SpongeBob SquarePants!
Absorbent and yellow and porous is he.
SpongeBob SquarePants!
If nautical nonsense be something you wish,
SpongeBob SquarePants!
SpongeBob SquarePants!
Now, coverage where you live, with an eye on breaking news. This is Local 12 at 6.
Hey, look, it's human!
A local woman who has started blogging about some painful symptoms asked us to ask experts at TriHealth this week about what is often a hidden health problem. Medical reporter Liz Bonus tells us more about it in today's Medical Edge.
Jessica Gabbard started blogging about some pretty serious symptoms recently after feeling no one understood her struggles. She says she's had everything from double vision to breathing problems, and at just 31 years old has already had 6 surgeries. Part of the reason she is choosing to share her story, however, is to raise awareness of something she wants all of us to know more about. And that is what she refers to as a diagnosis of Graves' disease. It is something that comes from an altered thyroid. So what we wanted to know is, how do you know if you have it? And more importantly, what are the signs and symptoms? And how do you get treatment?
Disease is a type of autoimmune problem that causes the enlargement of thyroid. This is due to the thyroid gland produces too much of thyroid hormones, which is often called as hypothyroidism. Graves' disease is often the underlying cause of hypothyroidism. In Graves' disease, your immune system creates antibodies that causes the thyroid to grow and make more thyroid hormone than your body needs.
Medication is the initial treatment for most thyroid conditions. Too low does tend to be more common than too high. Nobody's quite sure what causes Graves' disease, but it does appear to be immune system related. If you think you have a thyroid condition, Dr. DeMarco says see your doctor. Blood and other tests are the best way to get a proper diagnosis and treatment. It will also help you avoid more serious complications, such as those that set in for Jessica Gabbard. In Blue Ash, Liz Bonus, Local 12 News.
It is just human disease. We won't get it. Get some rest now, Gary.
Several days later.
I'm feeling sick now. I think I need to call Sandy to help me.
Hello, SpongeBob.
I'm feeling sick.
Oh, you are sick. Wait a minute. I will ask Patrick to send you to hospital.
Hi, SpongeBob. Are you sick?
Yes, I need to go to hospital.
Oh, is it contagious?
Oh, I have no idea.
Let me call an ambulance for you. Come sit down here.
How are you feeling, SpongeBob? Are you feeling alright?
Oh, I'm feeling sick now.
No worries, SpongeBob. Tell me what do you feel and I will try my best to treat you. Let me see if I can solve this case. SpongeBob, I suspected you to have Graves' disease. Now, I will do FNA on you.
Now, doctor, will it be painful?
No, it wouldn't be painful. It will be over in a blink of an eye.
Wait, doctor, wait!
One eternity later.
Hey SpongeBob, I got one bad news for you. This is the result from FNA. SpongeBob, here don't have advanced technology. We have to send you to human world for further diagnosis and treatment.
Human world, here we come. Wow. Hi, have you seen this doctor?
Invaders! You get out of my sister's sandcastle!
We need to find a faster way. Look, it's a doctor.
Oh, every time I see you, 그대 눈을 볼 때면
The doctor named me. I'm not human. What should I do? What should I do?
Shut up! I will transform you now! Oh, in a magic world!
Ooh, adios, SpongeBob.
Look, I'm human. Let's meet the doctor.
Nurse, give me the file of Miss SpongeBob.
Okay, doctor. Here, doctor.
Okay, thank you. Okay, from the laboratory findings and investigation, she has been diagnosed with Graves' disease. Alright, she is here today?
She's here today.
Oh, okay. So in that case, Miss, could you please just go and get additional information from her and tell her that her next appointment will be in 5 days.
Okay, doctor.
Okay.
Miss SpongeBob? Miss SpongeBob?
Yeah, maybe.
Hi, Miss. Good morning.
Hi, good morning, miss.
How are you today?
I'm fine, I think.
Okay, I see. We have gone through your medical file. And before you see our doctor, I want to ask you a few questions.
Yeah, sure, can.
Does anyone from your family have Graves' disease?
I think no. I think all my family is healthy. Even my grandmother and father also healthy. Even my Gary is healthy too.
Oh, who is Gary?
Gary is my cat actually.
Oh, I see. You have cat.
Yes.
And how about your medical checkup previously?
Oh, I go to the hospital at my place and the doctor said I'm diagnosed with Graves' disease.
Oh, okay. Have you done any treatment?
So far, no. That's why I came here to seek for the treatment.
Okay. How about your quality sleep lately?
Lately, I can't sleep lately, but I think it's okay.
You cannot sleep, but you think it's okay, okay?
Because I have my back.
Do you experience uncomfortable or irritability?
Yeah, because My leg actually is swollen, but you didn't see. Yes, it's actually swollen. I'm so shy. I don't know what to do, so I came here.
Oh, I see. Then you have goiter then.
Yeah.
Oh, okay. And do you experience any muscle weakness before this?
Yeah, but sometimes.
Sometimes. And my last question, what do you think about your skin and your hair conditions?
My skin is. I think my skin is okay, but a little bit brittle. And I don't know about my hair because I don't have hair.
Oh, okay. So you don't have hair.
Yes.
Alright, miss. I think that's all my questions. And I will set your appointment will be 5 days later at 10 a.m. I guess, and I will confirm you if any change, on the schedule.
Okay.
And I think that's all. You can come back again. Thank you, miss.
Okay, thank you, nurse.
Several days later.
Doctor will meet you in a while.
Okay, nurse.
Doctor, I have gotten the information from Miss SpongeBob and she's awaiting outside. Shall I call her?
Yeah, but in a while later, can I see that first? Nurse, I'm suspecting Miss SpongeBob is diagnosed with Graves' disease. I'm suspecting the laboratory result of Miss SpongeBob could be false positive. So I would like to do the laboratory investigation again using other samples. So first, what you do, go and get her blood sample and send to the lab to check on the thyroid function. And I expect the TSH level will be low and there will be elevation of the T4 and T3.
Doctor, why not we check on antibody levels?
Yeah, the lab test just now could detect the presence of thyroid antibodies as well. So it's basically to diagnose the patient's disease and distinguish it from other autoimmune diseases. Generally speaking, I hope I could see the presence of TSI, that is a diagnostic of the disease. Next, send the blood sample to the radioimmunoassay method because serum total T4 concentration can be measured by radioimmunoassay. Then after that, do T3 resin uptake test, and lastly do the get her saliva sample and do the test to detect the underlying problems of the disease.
Doctor, how to do the sample collection?
Oh, the test requires the patient to obtain 4 saliva samples at different points throughout the day, and it will help to reveal the health of the adrenal glands.
Okay, alright, Doctor. Anything else?
Oh yeah, lastly, not to forget, do adrenal stress index test. This is to measure the cortisol level in the patient, where frequently the people with a weakened adrenal glands will have a low cortisol level in morning when it's supposedly to be normally high. So yeah, that's all.
That's all. Okay, Doctor. Noted. Thank you.
4 to 6 more days later.
Miss SpongeBob?
Good morning, Miss SpongeBob.
Good morning, doctor.
Based on your laboratory investigations and results, you are diagnosed with Graves' disease.
Seriously, doctor? Am I gonna die?
No. We are here. We can treat you.
Please save me, doctor.
Sure.
SpongeBob